Welcome back. We're continuing the news. Local experts say they're beginning to see an increase in COVID-19 patients who are suffering from psychological and neurological problems. Shamela Pullen has that story.
The long-term effects of COVID-19 has been documented. Damage to organs, fatigue, shortness of breath are common among people who have recovered from the virus. Scientists have recently added psychological and neurological problems. A recent study from Oxford University showed that a third of COVID-19 survivors suffer brain disease. In the U.S., they found 34% of COVID-19 survivors received a diagnosis for a neurological or psychological condition within 6 months of their infection. As for Jamaica,
anecdotally, it's been reported that the psychiatrists and the neurologists are seeing patients that after they have been admitted to the ICU, after they've been treated for COVID, will develop psychiatric or neurological conditions.
In a recent interview, Tamisha Griffiths, who was a patient at the University Hospital of the West Indies, UHWI, recounted reactions from patients at the COVID ward.
They're like, why am I there? Nurse, pull off the mask and take out them IV. Most, like, they have patient up there, they have to tie their hand down, hand and foot, so them can't get up or them can't move. Them just have to attend to them. Not doing so well at all. Mentally, it like the COVID thing mentally sometimes get to them.
Consultant psychiatrist Dr. Earl Wright explains that this type of behavior is common among COVID-19 patients who were hospitalized.
Remember, when you have COVID particularly, your oxygen to the brain is diminished. And if the oxygen to the brain is diminished, you are going to have an altered state in the brain and usually a delirium. In other words, you become confused, you are not able to interact with your environment appropriately.
Persons who are suffering from mental effects from COVID-19 need to see their doctor as soon as possible. Dr. Wright is also encouraging persons to talk about the experience with loved ones.
Sharing it within your family about how bad it was, all the things that happened in the ICU. Get it off your chest. You are not talking about it to solve a problem. You are talking about it to get it off your chest. And the more you talk about it, the more you will feel better.
Shamela Pullen, TVJ News.
161 new cases of the coronavirus were recorded on Monday. The number of confirmed cases now stands at 42,924. Meanwhile, 6 more Jamaicans have died from the virus, bringing the country's death toll to 682. Hospitalizations have dropped to 384. 37 people are critically ill, while 35 have been classified as moderately ill. There are 22,802 active cases.